A 55-year-old man with hypertension, hyperlipidemia, type 2 diabetes mellitus, and asthma comes to the physician because of 2-month history of intermittent dry, hacking cough. He has no fever, chest pain, shortness of breath. He's not there. He does not smoke cigarettes. Current medications. Please focus on this. Simvastatin, metformin, albuterol, and ramipril. His temperature is 37 degrees Celsius, pulse is 87, blood pressure is 142/88. Cardiopulmonary examination, no abnormalities found. Which of the following is most appropriate initial action by the physician? Very easy. Ramipril, you just have to see that word. Ramipril causes hacking cough and intermittent dry cough. You just have to stop the drug and then start on ARBs, which doesn't have cough and angioedema side effect. Okay, that is the answer. Let's just read quickly. That is because why is there cough in AC inhibitors? Why is there cough in AC inhibitors? Bradykinin, correct. Bradykinin is broken down by ACE to its degradation products. So if you're blocking the ACE, there's buildup of bradykinin, which causes cough and angioedema. That's the answer. Yes, vasodilator. That's why it causes vasodilation causes increase in permeability of the vessels. Also, increase in permeability of the vessels causes angioedema. Correct. Then let's read quickly once. Ramipril is an ACE inhibitor, a class of drug that is known to cause characteristic dry cough, right? ACE inhibitors decreases blood pressure, correct, because it is an antihypertensive for sure, by inhibiting the RAS system, right? Inhibition of ACE also causes an increase in bradykinin, which can lead to bronchoconstriction and dry cough. Patients presenting with cough caused by ACE should be changed to ARBs, which don't have cough and angioedema side effect. That's all they want. What is dextromethorphan? It is NMDA receptor, a glutamate receptor antagonist. Please remember this too. It might be a question some or the other way. Okay, it is a cough suppressant. And simvastatin, atorvastatin. The options are very irrelevant, and that's why it's easier. And ramipril and lisinopril are both ACE inhibitors, so you don't want to replace. Any important side effect of ARB? No. There is no important side effect of ARB. Only important side effect of AC inhibitors is asked: cough and angioedema, and all the other side effects of AC, the ARBs have. Okay, and I think you are not supposed to use that in renal artery stenosis, if I'm not wrong. I heard once so asked. Also affecting potassium. Same. So other side effects of AC inhibitors, hypotension and hyperkalemia, is similar to ARBs. They have the same side effect.
Thanks for watching. Please give a thumbs up and subscribe for more.